Hi, my name is Dr. Rudra Mohan and today we're going to be talking about, are dental prostheses safe for doing MRIs? Let's start. So today's episode is very interesting because I've had this interaction with one of my patients who was asking me about the different types of caps that can be placed, and they were showing some apprehensions about metallic caps or metal coated with ceramic or PFM caps, because of the fact that if they asked me this question, if they want to go for an MRI, are they safe in terms of the magnetic field that is created by the MRI? So I thought I'll go back to the books because I already know as per my experience that there are not much of problems when it comes to metallic dental prosthesis, but I thought it is my social responsibility to educate and spread awareness about this fact when people are getting their dental treatment done. So MRI is basically magnetic resonance imaging, which is used to image the different soft tissues and hard tissues of the body just in order to check any lesions or for any diagnosis. So the MRI machine is basically a huge electromagnetic, and that creates a huge and a powerful magnetic field. Obviously, for obvious reasons, if you're placing metallic restorations, you're placing metallic dental prostheses in your mouth, including your dental implants and orthodontic brackets, they might be having some sort of magnetic field or magnetic susceptibility that can create three effects when it comes to interactions. The first interaction is the magnetic artifact on the image. So every ferromagnetic metal has a magnetic susceptibility. So obviously when you're creating a magnetic field, that it would cause some sort of a different magnetic field of its own because of its magnetic susceptibility, thereby creating an area of distortion on the image, which can lead to interference or some sort of disturbance in interpretation of the image, which will create a radiographic or a magnetic resonance imaging or an MRI artifact, thereby clouding the diagnosis, right? That's the first interaction. The second interaction is because of the fact that it's a metallic object and it's placed in a magnetic field which is very strong, you can help develop eddy currents. Now, I don't want to go into the physical aspect or the physics of eddy currents. Basically, these eddy currents can help produce heat. Now, the oral mucosa, that is the mucosa of your mouth, is very tolerable when it comes to temperature rise of 8 to 10 degrees, not more than that. And it has been found in the studies that the temperature rise when it comes to eddy currents being produced in an MRI machine, the temperature can go up to maximum 2 degrees or less. So that way it's not a problem for most of the dental restorations. Now comes the biggest part. It is a magnetic field. So obviously a magnetic metal, that is a ferromagnetic metal, will get attracted towards the magnetic field. And it is a very powerful magnetic field, because of which a lot of people need to understand that they are asked to remove all their metallic objects that are there, including piercings and everything. So now when it comes to, let me talk about one prosthesis to another. When it comes to metal crowns, usually there have not been much of reports. There's just been one or two reports, that too from Australia, where metallic crowns do contain some ferromagnetic elements such as molybdenum, beryllium, alloys like nickel, chromium, cobalt, chromium, which do have some ferromagnetic properties and some sort of a magnetic susceptibility. Now this can probably lead to the displacement of the crown from the tooth. However, it has been found, and these studies have been done in vitro, that the luting cement that is used to cement the crown on the tooth surface, it is actually very powerful to bind it even if the magnetic field tries to pull it. There has been one case report from Australia where the patient actually had gone and gotten the crown fabricated from Indonesia as a part of dental tourism, and that's why they were not aware of the composition of the crown, and that's why when she was going through the MRI, she was feeling the sensation of the crown getting pulled out. Now it never happens that the crown will just jut out so fast and it will lacerate your cheek and it will come out. It's not going to happen. And also the luting cement has been found to be very strong. The only thing that you need to do is, if your prosthesis is very old, be it a crown or a bridge, you need to really understand that you have to get a dental workup checkup done, so that you know that if the prosthesis is very old, that the luting cementation failure should not happen. That means the cement should not cohesively break apart from its own failure, and then it can create to the dislodgement of the restoration. Coming to orthodontic brackets, it's very simple. When you have orthodontic brackets, it is a ferromagnetic material, and it is always advised that you should always get them debonded before the MRI. Now it's a different thing if it's an emergency MRI, that's a different thing. And also it has been found that if they have been bonded very nicely to teeth and the ligature wires are very tightly wound, which is very normal for a normal an orthodontic case, they can withstand the magnetic field. But however, I would strongly recommend that if you are a braces patient and you're going for an elective MRI for diagnosis and treatment planning purposes, especially in the dentoalveolar region, it is always better for you to get them debonded and rebonded later on after the MRI has been done. Coming to the next big thing, that is the implants. Now implants are made up of titanium. Titanium thankfully is paramagnetic. That means it will not get attracted to the magnetic field, and you can easily get the implants placed in your mouth and it will not have any sort of magnetic pull effect when it comes to the solenoid, that is the MRI machine, and the magnetic field which is very strong that is created with it. When it comes to removable dentures that have a metallic component, it is always better to get the dentures removed and then you can go for the MRI. For fixed dental prosthesis, as I've already mentioned, you have to see and evaluate if the luting cement is strong enough or it has not been there for a very long time, that it has gone any sort of structural weaknesses in the integrity, thereby leading to cohesive failure. So this was today's episode. Please like, share, subscribe and do press the bell icon button for important updates. If you have any queries, doubts, apprehensions or insights, please feel free to put them in the YouTube comment section and I will get back to you after some time. So that's it for today. Thank you.